Hi everybody, my name is Helena Farrell and I'm the founder and clinical director of Diabetes Insight and the Cork Health and Lifestyle Centre. So this week I'm going to try and each day bring you maybe some little practical tips that will help you in managing your diabetes a bit more effectively and maybe increase your confidence in helping to manage your diabetes as well. So today I'm just going to focus a little bit on the low GI diet, because for me the low GI diet is the foundation stone really of all diabetes management. I've been working with it for the last 15 years and I really advocate for the low GI diet across the board in both type 1 and type 2 diabetes. And the reason being is that I find, especially with type 1 diabetes now, in the advent of carbohydrate counting, is that people are focusing very much on the fact that they can kind of eat what they like and just take the correct amount of insulin according to what they're actually eating. But the problem is that I'm beginning to see now that people with type 1 diabetes are actually developing a weight problem, because obviously insulin is a hormone, and the more insulin you take, the more likely is the weight that you'll actually increase. And then layered on top of that, foods that might be high in fat, not necessarily high in sugar, but actually high in fat, convenience foods, that kind of thing. So really the whole idea is to try and get people's heads around following a low GI diet as a foundation, and then carbohydrate counting on top of that. So when people come to see me in my clinic in Cork or around the country, normally that's where I get them to start. So we start with the low GI diet and then we build up a carbohydrate counting for type 1 on top of that, an insulin dose adjustment. So the whole idea of the low GI diet is GI stands for glycaemic index, and the longer it takes the food to burn through your body, the less likely it is to cause your blood sugars to rise 2 hours after eating. And we know it's the blood sugar levels 2 hours after eating are really the ones that affect the HbA1c the most. So the beauty with the low GI diet is that it slows down the release of sugar. So rather than getting a kind of a Mount Everest of a spike of blood sugar levels 2 hours after eating, you're always going to get an elevation, but you're kind of taking it more from a Mount Everest into more of a little hill, and you're slowing down that impact. And by doing that, over a 3-month period, you should be able to come out with a fairly good HbA1c. Often I find is when we do start this low GI diet program with people, whether they have type 1 or type 2 diabetes, when we bring them back for their HbA1c within the 3-month period, normally it will have come down anywhere by about 0.5%, which is brilliant. I mean, if you can take a HbA1c from 7.5% to 7 or so on and so forth, I mean, it's fantastic. I tend to follow a very particular type of a low GI diet by a guy called Rick Gallup, and for the simple reason is that it's not insulting people's intelligence, but it's really, the more simpler you can make something for people, the easier it is to understand, the easier it is to implement, and the easier it is to maintain down the road. And for a lot of maybe parents with children with learning difficulties, I'm coming across maybe a lot of parents with type 1 kids who might be diagnosed with mild spectrum autism, dyspraxia, ADHD, things like that. Basically, what we try and do is work with a low GI diet. Because obviously if you have a child maybe even suffering from with dyslexia or undiagnosed dyslexia or an undiagnosed learning difficulty, that can become a hindrance when you're trying to implement something like carbohydrate counting or insulin dose adjustment and so on and so forth. So the simplicity of the one by Rick Gallup is it works like a traffic light system. Anything in the red column, because the book that you buy is actually, it's divided into 3 columns with food groups in each particular section. So you might have fruit, say a page dedicated to vegetables, another page dedicated to breads. And everything in the red column that's listed, you stay away from it. Everything in the amber you can have kind of within reason, and green suggests obviously it's good, you're good to go. But again, you have to watch the portion sizes. And it can be a real learning curve for people, especially take for example something as simple as porridge. If you make porridge the old-fashioned way, up, you know, say like the oddlums or the flavins bag, and you mix it with milk or water or whatever, and you steep it overnight, really that doesn't have much of an effect on your blood sugar levels. But if you run for the ready break or the quick oats in the morning and pop it into the microwave, because that type of porridge is more processed and more refined, it tends to elevate your blood sugars much more quickly than the old-fashioned way. So that's just a very simple little explanation of the low GI diet and maybe things that you might not necessarily be aware of. I am going to be talking more about the low GI diet in a talk that I'm hosting with Diabetes T1 Ireland in the West Grove Hotel in Clane, County Kildare on the 25th of November at 7 p.m. So anybody who's in the East or in Leinster, you're more than welcome to come along on the night. Tickets are €10 at the door. You can book them online through www.diabetesinsight.ie. Also, I have a private practice based in Cork, and I'm more than willing and able for people to come to the centre and attend one-to-one consultations where we go more in depth with the low GI diet, looking at maybe how you can implement it around a type 1 regime or as for type 2s as well. So tomorrow I'm going to be talking to you about HbA1cs, and I'm going to be coming from the clinic in Cork doing that because that's where my little machine is based. So I'm going to be giving you a practical demonstration of the HbA1c analyzer that we actually use in the Cork Health and Lifestyle Centre. So I look forward to seeing you all tomorrow.